Hi, this is Brian Mormons recording a lecture on finance for management, leadership, and professional issues. So some of our learning objectives here will be discussing some of the key terminology of this. So budgeting, resources, expense, revenue. We're going to also talk about ways to provide cost-effective care. And then we're going to talk about ways that healthcare is paid for. So paid for performance or value-based purchasing or other things. So U.S. healthcare spending, I don't think this surprises any of you, the fact that we spend a lot on healthcare. Unfortunately, that doesn't always reciprocate with our morbidity, mortality statistics. And so we can see that, we spend a lot, but we don't always get that long-term longevity off of this as compared to other countries. So when we see our, GDP spending and stuff like that, infrastructure, military, education, and healthcare is here. So if you really think about what we're spending this on, a lot of it goes to chronic diseases, so obesity, type 2 diabetes, heart disease, lung disease, and you can understand why. I'd also say cancer is probably going to be in here as well. So we can kind of think about this and think about how that's going to play into healthcare and how we as nurses can assist with this. We could also think about, wasted healthcare dollars. Did they have the services that, truly weren't needed? Admin costs, inefficient delivery of care, inflated prices, fraud, prevention failures. All these things lead into, billions of dollars worth of money that we could save in and roll into other, more effective techniques for delivering healthcare. So within this, though, we do have to realize that we've got these main sources. We got to learn the basics of, finance. It's all well and good that we want to help people, but we also do have to run a business, because if we are so altruistic that we help them out, but yet we're not having a business model and we're not efficient and we're not getting money back and we're not able to continue and the hospital's closed, then that's a major problem too. So we need to talk about budgeting, we need to talk about revenue, we need to talk about expenditures and all those kind of situations. So within this, we have to have an operating budget. This is tracking, your revenue, the money that you're taking in, versus expenditures, the money that's going out and that you need to have your business. Profit is what's left over from, taking your money in, paying your expenses out, and profits, what's left over. Market share is looking to see, how much of that business is coming towards you. So in Sioux Falls, we've got a couple of different high-functioning healthcare facilities. Obviously, you can think about Avera and Sanford, but then you can also talk about VA, you can talk about LifeScape, you can talk about some of the surgical hospitals. There's lots of other little clinics around town. And so what is that market share? And why that matters is you're trying to make an estimate as to what your revenue is going to be, how much money you can bring in, how many services you can offer into that community, and what are you going to get paid back for that. Like I said, it's great to be altruistic, we want to help others, but we have to do it in a manner that's sustainable. If we give everything away and the hospital is closed, that's not good either. So resource management. Within this, resources can be a lot of different things. Oftentimes we think about the equipment that we use. So like up in this upper hand corner here, we're looking at scales and sphygmomanometers and otoscopes and all these kind of different things. But on a broader scope, it's the time, it's the people, it's the staff. Honestly, in an organization, staffing is probably one of the biggest resources that they have and that they spend money on. And so that's a major component for this that we have to consider. So within resource allocation, it's who gets what. If you've got 15 different floors that are buying out of this or vying for the same money, who's going to decide who gets what? Who gets the new equipment? Who gets what equipment? Who gets to increase staffing? Who has to decrease staffing potentially? So that resource allocation is a really important part of resource management, and that can be very tough at times. So expenditures, So like I said, we think about, buying these things, but it is also employing staff, taxes, wages, not just the payment that you're making to them. It's what part does the company have to pay for taxes? What part do they pay for any benefits? Any other benefits that would be like, oh, we're going to cover your license, we're going to cover CPR, we're going to cover, we'll put into HSAs, we're going to put into healthcare, dental care, et cetera, et cetera, et cetera. So there's lots of different costs that go with your employees. So the gross revenue, that's the amount of money that a business makes from selling its product before subtracting any of these. Net revenue is the amount of money a company brings in after subtracting all these returns. So costs, taxes, other expenditures, discounts, price reductions, other allowances, and costs. So how do we provide a cost-effective care? Because we want to do that. We want to provide our patients with good quality, but we also want to have good value with this. And so what are some of the cost containment things that we can do on this? So as you're thinking about it, what are some of the things that we do? In healthcare, we can only do so much sometimes. I mean, like, we're not going to reuse Foleys. We're not going to reuse, IVs and stuff like that, which is just gross if you think about it. But how can we contain the cost? Do they need this procedure? Do they need this, do they need a new glove every time that you're doing something? Or that's probably a bad example. But think about all the things that we offer them. Think about what we charge for them, and really try and think about what's truly needed. So, in ways to try and do that, what's health promotion, disease prevention? Generally speaking, you'll save, spend pennies on the dollar on this one. So you spend pennies and get dollars back if you can prevent stuff. If you can prevent those diseases that we talked about with obesity and diabetes and cardiac disease. Using evidence-based care. I mean, that's why we do it. What's the best for this? What's our best outcome? What's our best value? And then, looking at that cost-effective resource management. How can we make this more affordable? We can buy in bulk. Like, you will see, like, hospitals will do that. And they'll merge. And when they merge to have a bigger healthcare institution, of course, that makes it so that they can buy in bulk, get things cheaper per item, and do some of those kind of situations. Also, how can they offer it cheaper? How can they eliminate some of the middlemen and women out of there to try and make it more effective? So think about that when you're providing care to your patients. Yes, we always want to do what's best for them. Yes, we always want to give top-notch care. But what do we really need to do, and what's going to be best overall? So how do we pay for healthcare? I mean, the traditional model is fee for service. So when a doctor provides a fee or provides a service, they bill for that. Whether that's a surgery, whether that's a office meeting, whether that's any kind of technical thing that they're doing, whether it's consultation, all those type of things, they will bill for that. There are a couple of different newer models out there, pay for performance, PPP4P. And so what that's looking at is that it's, of course, doing this, but they're also looking at quality targets. So if they're doing a surgery, they're going to get dinged if they have high readmission rates. So if all of their appies come back in 2 weeks and they've got an infection, of course, they're not going to get more for that. So in the traditional model, they would have the surgery, and then with that, any complications that they're seeing or stuff like that, then that would, of course, be more revenue for that provider. Where in this one, there's quality targets involved with this one. And so if they're not meeting those quality targets, then they're actually losing money. So, and those things could be medication adherence, high patient satisfaction scores, low readmission rates, all those different things, looking for trying to increase quality. And then value-based purchasing. So you're talking, it's kind of a pay for performance, but we're also looking at, cost-effective care. So it's elements of this, like patient experience, overall cost of care, but really trying to make this affordable for people as possible. So these are really broad topics. I covered it very thinly, but these are definitely areas I want you to know for the exam. Talking about these key terms, talking about ways to provide cost-effective care, and then looking at how we provide services and how we pay for the health care that we receive. If you have any questions, contact me.